People. It's another beautiful day with us here today with your fertility specialist. I want to say thank you to every one of you for joining our live stream for today. It's amazing to always have you on set. So, you know how we do it. Like always, like, share, and then you comment when necessary. You can ask questions. We're available. Thank you very much. And then today, with me here in the house, we have an amazing person here, the delectable Dr. Jane Ojani, the consultant gynecologist. It's always good to see you on set, Dr. Jane.
Thank you, Rejoice.
You're welcome. So, today we have an interesting topic, menstrual health. Hmm. Well, I've had a little bit of myths about menstrual health, especially when you hear a certain group of people say it's an unhealthy, it's an unclean thing. You see, maybe a husband tell his wife not to cook when she's seeing her menstruation, and the rest, like a lot of it, a lot of myths about it. So it brings me to the question: what is menstruation?
Well, menstruation, as the word implies, is a Greek word. What it just means, the menses means month, from
Okay.
also relating to the moon, something lunar, which is
Oh,
cyclical. And it
oh,
just tells you that menstruation is the monthly or cyclical shedding
mm,
or shedding of the lining of the womb. And basically it also tells you it's an outward sign of a
okay.
woman's menstrual health,
Mm,
and also tells you about a woman's general health, because if you have it monthly, it
mm,
means that your menstrual health is actually in check and
okay.
things are also normal. So it also tells you.
Okay.
And of course, menstruation occurs when pregnancy feels to occur, because the monthly cycles actually talks about what it does is just preparation for ovulation and
Mm,
implantation. And when this doesn't happen, you just shed off the bed that was prepared for the baby to implant.
okay. Okay. All right. So, how does the menstrual cycle impact the person's overall health and his well-being?
Well, menstrual cycles can impact an individual's
Okay.
health,
Mm,
both physically,
mm.
mentally, and even otherwise.
Oh,
Physically, it can, the menstrual cycle is in phases.
okay.
And for each phase, there are some things that happen in the body, the hormones, the
Mm,
changes that occur.
mm,
And this can affect the woman in different ways.
mm,
Like for days leading to the shedding of the menstrual line, that's the menstruation.
mm.
You see a lot of women come down with pain,
Oh,
fatigue, loss
mm,
of energy, and this can impact their work-life balance.
mm,
A lot of people have severe menstrual pains.
okay.
This can also affect them.
Mm,
Basically, there are some women that also have this condition, what we call premenstrual syndrome. It's
mm.
a group of psychological symptoms where these people are
Oh,
irritable,
okay.
oftentimes relationships are lost, and
Oh,
all of that. Then
mm,
not to talk about even their health, the
mm,
woman's well-being,
mm,
where there's excessive blood loss, then she's weak, she's
mm,
sick, she has to be admitted for either for blood to be given to her, one pain treatment or the other.
mm,
So there's a way it can impact, and all of these have a way of affecting the woman's
mm,
psychology, being that you might just be having this problem while your next door neighbor is having it all smooth
mm,
without issues. But generally, every woman has the hormonal challenges, which, though we have a lot of people with mild forms of the menstrual
okay.
problems affecting them physically and all of that, then we have the very bad forms. About 8% of the women will have severe forms of all these
Oh,
issues.
okay. Wow. That's a lot. So it's it's okay then to say some people are not over exaggerating when they say they have a very painful
No, not at all. Some
menstruation.
menstruation can be so
And
excruciatingly
oh
painful that
wow,
you
okay.
you you wonder if this is the same menstruation other
Mm,
women go through. These women need serious help,
mm.
psychological
Oh,
guidance that would help them pull through this
mm.
problem.
Okay. Is there any particular reason why they have this exaggerated pain, or it's just menstruation?
Well,
Mm.
there are conditions that
Okay.
can make a woman have pains during menstruation.
Oh,
And
okay.
these pains, it can be from conditions like, well,
Mm.
If we have conditions where the lining of the womb is seen on different on places not in the womb,
Oh,
like a condition called endometriosis.
wow.
So it just means the lining of the womb is found into where it's not supposed to be. These women have significant pain,
Oh.
and it also impacts their life, work-life balance with
Hmm.
a lot of infertility and all of that.
Hmm.
Then we now have women with fibroids,
Oh.
depending on the location
Hmm.
they can have significant pain.
Wow.
Women that have this endometriosis, there's also adenomyosis, they can have heavy
Hmm.
bleeding with pain.
Hmm.
So different conditions can cause pain during menstruation. And for every pain these women have,
Hmm.
they are not exaggerating. This pain is real. This pain, you can feel them when these clients come to you.
Oh, wow. So, is there a remedy for that?
Well, there's remedy for painful period.
Hmm.
Well, generally when you have pains, you can use the pain meds,
Okay.
what we call analgesics.
Hmm.
Then, but for these conditions, we now have specifics to treat.
Okay.
Even for these women that have this pain I mentioned, what
Hmm.
you do, for those that have pain with for endometriosis, what happens is that those linings that are in the wrong places, they
Hmm.
shed off just like you are shedding the one in the womb.
Oh.
So for every time it touches, there's some form of irritation and
Oh.
pain.
Oh.
So you
Okay.
can try to do what you can try to do is we try to do is sometimes try to see how we can control or
Hmm.
reduce the frequency of periods. That
Hmm.
we can do with hormones,
Hmm.
we can do or can also do what we call a special kind of procedure where you look into the tummy to
Hmm.
burn off those tissues around. You
Hmm.
can also do surgeries to take out some of those abnormal tissues that shed every time in the month. So there are different options. For those that have fibroids causing pain, depending on the location,
Okay.
you can have a fibroid surgery.
Oh.
So depending on the situation, those that have adenomyosis, they can have drugs, they can have their uterus taken out, depending on
Oh.
the degree, the grade, the woman's situation, and also
Oh.
her reproductive wishes. Different
Hmm.
options are available for them.
No, wow. I think I'm learning a lot from you today. So, now the menstrual cycle in general, are there phases of it? Uh,
Yes,
okay.
interesting.
Mm-mm.
There are phases.
Mm.
So for you to have menstruation, you need a functional brain,
Okay.
you need an ovary, and you
Mm.
need a uterus and a proper functioning outlet. I
Okay.
mean, the cervix and the vagina.
Oh, okay.
Now, for the phases, we'll
Mm.
talk of what happens. We have what we call the ovarian cycle and
Okay.
the one that happens in the uterus.
Oh.
So, these phases for the ovary, we have
Mm.
what we call the follicular phase
Mm.
and the luteal phase.
Okay.
I will explain. So, the
Mm-hmm.
while I want to tell you because I say the coincides.
Okay.
While for the uterine phase, we have proliferative phase. This is when the lining of the womb grows, and the
Okay.
secretory phase. Now, this
Okay.
proliferative phase and the follicular phase, they coincide. They tend to be from the first day of the woman's menstruation.
Okay.
What happens during follicular phase? Basically, the ovaries, the brain sends a hormone that helps to recruit a lot of follicles. In these follicles, we have eggs that eventually released at
Mm.
ovulation, and that marks the end of follicular phase as
Mm.
soon as ovulation happens. So
Okay.
once ovulation happens, we now have what we call a cyst, a corpus luteum, or something that produces progesterone to
Mm.
prepare for pregnancy. So
Okay.
when pregnancy doesn't occur, it
Mm.
withdraws, and that lining that has been prepared is shed off, and that
Mm.
brings the end of luteal phase.
Oh.
So just same thing. So once we are having the follicular phase, so they'll go simultaneously or together. So once the follicular phase is on, the proliferative phase is also going. So the line of the womb is growing.
Mm.
Luteal phase is on, the secretory phase of the uterine cycle too is
Mm.
going on. So that goes on together. So those are the phases. Of course, these phases have symptoms.
Mm.
So, like in the follicular phase, that's when the start of menstruation. You can
Mm.
have acne, you can have some pain, you can have fatigue, and all of that.
Okay.
In the luteal phase is the time where you have lots of progesterone in preparation for another menstruation.
Mm.
Then you now have progesterone like kind of effect where we have
Mm.
retention of fluid And breast fullness, breast tenderness, breast pain,
Okay.
irritability.
Mm.
That is the point where you see some people with what we call premenstrual syndrome with the whole irritability thing and the whole relationship troubles. Yeah.
Relationship troubles. So, viewers, I hope you're taking notes because I am. All right. So, how long does the average menstrual cycle last for?
Well, the average menstrual cycle lasts it's a range. So
Okay.
we have it between 21 and 35 days. So any
Okay.
period between this
Mm.
range is assumed to be normal. Yes, on the average, a lot of women will have it around 28 days, but
Mm.
anything less than 28, more than 28, so long as it falls 21 to 35 is perfect.
Okay, so between 21 to 35 is considered the normal
Menstrual
menstrual
cycle.
cycle. So anything above 35, it's abnormal.
Well, anything above 35 will now get us to what we call oligomenorrhea, infrequent periods, and that is a problem.
Wow. Okay. Okay. Well, so you mentioned some of this, like you just mentioned oligomenorrhea. So that's I am trying to understand what it is.
Well, oligomenorrhea just tells you that the person's periods are infrequent. So
Okay.
for some women, you have like 8 cycles in a
Mm.
year or
Mm.
even less. So you have
Oh.
up to six, you have four.
Mm.
A woman is supposed to see her period, like we described earlier,
Mm.
monthly. So
Mm.
if you have 12 months in a year, you should see your period at least
So,
12 times in a year.
okay.
But you see anything about less than, when you have it more than 35 days, you tend to have them infrequent, and less than 8 is assumed to be infrequent, and it should be evaluated for causes of infrequent periods or oligomenorrhea.
Okay. So, are there other problems associated with menstruation aside the one you just mentioned?
Yes,
Okay.
there are a lot of problems aside oligomenorrhea.
Mm.
We also have well, heavy periods, what is
Okay.
commonly called menorrhagia.
Okay.
So a lot of times, for every cycle a woman has,
Mm.
what is shed is just about 30 mils of blood. Yes, it
Mm.
looks a lot because of the lining, cast, and fluids are all mixed in the blood.
Yeah.
Yes, but it's just 30
Mm.
mils. So any woman that goes above you now have anything in excess of 80 mils is
Oh.
assumed to have heavy periods.
Okay.
And a lot of things are responsible for those heavy periods, like
Okay.
fibroids. Yes, we have the adenomyosis, we have infections. If you have
Okay.
some kind of contraceptives, like the intrauterine contraceptive device,
Okay.
all those things can cause heavy
Oh.
period.
Wow.
We also have people that have what we call dysmenorrhea, like we
Mm.
described earlier, painful period. It can be primary, it can be
Mm.
secondary. Those are problems of menstruation. We had mentioned the common causes like
Mm.
endometriosis. I talked about the glands or the lining of the womb being not meant to be.
Mm.
We also have people problems of menstruation like what we call absent menstruation,
Mm.
amenorrhea. So
Mm.
this can be primary or secondary. You see a girl over 15 years and
Mm.
probably she had developed breast by the age of 12, 3 years after no menstruation.
Mm.
That is a primary form, or someone that's not even developed any secondary sex
Mm.
characteristics
Okay.
and she doesn't see. It's a problem of menstruation.
Wow.
Yes, they will now have secondary. A woman that has not seen period for 6 months
Mm.
or 3 cycles. You know, we have talked about menstrual cycles.
Mm.
3 cycles, and she's not breastfeeding, she's not lactating, and she has not been confirmed menopausal,
Mm.
then that is a problem. We now
Okay.
talked about premenstrual syndrome. That is a significant problem. In fact, it's some places are grading it as a psychiatric disorder.
Mm.
Then we now have postmenopausal bleeding. You see a woman who has stopped seeing period, then about 2, 3 years down the line, she starts to bleed.
Yeah.
So it's not menstruation, it's a problem because
Okay.
it could be cancer of the womb, it could be
Oh.
cancer of the
Wow.
cervix, it could be because of the dryness of the vagina, they are bleeding. Anything could be responsible.
Okay.
So the problems of menstruation are a whole lot. Then
Mm.
in a class, we have in the irregular menstrual, some people is because of hormonal issues.
Okay.
We have also PCOS as a what we call polycystic ovary syndrome
Mm.
as a cause of irregular abnormal problems with menstruation
Mm.
in a class of its own. So
Wow.
those are the major problems you have in
Wow, wow.
menstruation.
Okay, okay, that's a lot. So, like, from what I've gotten from what you said so far, you need a functioning brain, ovaries, and all of that for menstruation.
Uterus
Yeah.
and
So,
outlets.
okay. So, I've seen instances where you see a person not bleeding at all completely. Could that be normal? and then you find out. I've seen a person that gotten pregnant even with an absent menstruation. She has never menstruated before, but she has been having babies. So I don't understand idea.
Well, a lot of things can explain that, even though I don't know where this is coming from.
Mm,
But you see, a young girl
mm,
who has not menstruated
mm,
in the very earliest form of menstruation
yeah.
and she gets exposed,
Mm,
she can get pregnant if she had ovulated. Even though
okay.
it's not common for young girls, pubertal girls, to
Mm,
ovulate because of immaturity of the brain.
okay.
Then we now have, when you see someone has not menstruated, some women have what we call rapid repeat pregnancies. So
Oh,
from one pregnancy to the next, they are still breastfeeding. You know, I
and then
talked
they're
about
pregnant
breastfeeding
again.
making you not to, you
Yeah.
now have them another pregnancy because they will not even know when they ovulate. They just
Mm,
keep breastfeeding, then next thing they are pregnant.
pregnant.
Basically, because people that don't menstruate, they're likely not to ovulate. So I think
Mm,
these are the common people that might ovulate
mm,
without knowing because they are not seeing period. They
mm.
assume nothing is happening.
Yes.
Then we have women that might be on some contraceptives. It
Okay.
depends on when they inserted it. If it's an expired one,
Mm,
it might fail. What we call
mm,
failed. So
uh,
they might not be seeing periods and they get pregnant.
mm.
But generally, if you're not menstruating, you're likely not ovulating and you're not
Okay.
likely to get pregnant.
Oh, okay, okay. I'm learning. I hope viewers, you're really taking notes. Dr. Jade is giving us hot today. So, at what point should a person seek for medical advice when you're having some of this menstrual symptoms, some especially for the PMS, the ones you mentioned?
Well,
Mm,
you see, most of all these menstrual problems,
mm,
they come, will I say, they are graded. That's the
okay.
word. So a lot of women, a
Mm,
significant number of women have some of these menstrual problems,
mm,
but they are in the mild forms. So
okay.
these are the people that now will now might need medical attention will be
Mm,
those in the severe forms.
mm,
So you talk of premenstrual syndrome. A lot of women will complain about breast fullness, breast pain, but
mm,
they are still able to function. Then you
mm,
now have a woman that once her period is about to come, she's
mm,
irritable, she's not
mm,
able to function, crying spells,
mm.
not communicating,
Oh,
she keeps having relationship troubles. Then
uh,
she might need a psychologist to speak with her. She might
okay.
need some therapy
Mm,
to go with that. Then basically, you see a woman, heavy periods, she changes her pads maybe in an hour, is fully soaked. How
mm,
well I say, oh, menstrual product,
mm,
or she's using a cup,
mm,
whatever it is, she soils her beddings overnight, or she has to
mm,
change because of the whole blood spilling, or she
mm.
gets sick, dizzy,
Oh,
fainting, and all of that. Or
yeah.
you have significant pain, you are missing school, and all of that for the young
Mm,
girls
yeah.
or the older people that are not able to walk. You
Mm-hmm.
might need to seek medical help.
Mm,
Depending on the situation,
okay.
you will definitely get help. All of these problems actually have solutions.
Okay. All right. Thank you. These irregularities you talked about, how does it affect a woman's fertility?
Oh, wow.
Yeah.
Irregular periods.
Mm,
First, commonly, they once a woman has irregular periods, the
mm,
likely thing is that she's not ovulating
okay.
or she cannot predict her ovulation. It
Okay.
means conception will be a significant
Mm,
challenge. Then, when you want to even correct this irregularity and fertility treatment, because they don't even have a period, when to start and how to
mm,
monitor becomes a
a
significant problem.
challenge. Yeah.
Then, women that don't ovulate, they are
Mm,
at high risk.
mm,
They commonly have what we call luteal phase deficiency,
mm,
and as such, they might have increased miscarriages and all
mm,
of that. So it can so now we have difficulties conceiving. Then when you
mm-hmm.
now conceive, difficulties even retaining the pregnancy.
Yeah. Wow. That's a lot. So I'm just looking at the whole thing. So how then do you diagnose some of these things, especially for an adolescent? Maybe she's having, from home. There are some people that are not knowledgeable about all of this. So how then do we educate them? How then do we let them know that there's something like this? Because a lot of them have no idea.
Well, for
Mm,
adolescents or young
mm,
people,
mm,
that's why we say functional brain. So there are two common times where women commonly have irregular periods
mm.
that might be assumed to be normal.
Okay.
So for girls at puberty, when a girl just starts to menstruate, because of immaturity of the brain,
Mm.
they might have irregular periods, and
Mm.
it's not a problem.
Mm.
Most times within 1 to 2 years, it
Mm.
normalizes and they begin to have normal periods.
Okay.
Then women that are heading towards menopause, perimenopausal women,
Mm.
they tend to have irregular period. It's also
Mm.
a function of reduction in the
Mm.
ovarian reserve. So they are not. It's not really a problem. Of course, a problem when they are trying to conceive.
Mm.
So, but for that, so now we now have that. For diagnosis, if we are outside these two groups, then people need to understand when you have this knowledge that this is not a significant problem, you might give some time for a girl.
Mm.
Then for the young people with polycystic ovaries, they might bleed heavily and all of that. You might or they have this abnormal
Mm.
immaturity of the brain. They might not menstruate after 3 to 4 months. The line of
Mm.
the womb is so thick,
Mm.
they now have what we call breakthrough bleeding. It used to be
Mm.
very, it can be very heavy
Okay.
and can make them faint and all of that in school and all of
Mm.
that. So the history is very important. I just
Mm.
brought us through this road. So when you understand, when you're able to communicate with these people,
Mm.
when did you start to menstruate? How has it been? Has it been
Mm.
regular? What do you feel?
Mm.
When you feel so much pains and cramps, I would not forget while we're in school, we used to
Mm.
have some classmates that when their period comes, like they're so sick and down. So you know that
Mm.
thinking back,
Mm.
that is a significant problem. So based on the history, because the cause of menstrual problems, irregularity
Mm.
differs for people,
Yeah.
unless you interact with them, know their own problems, how
Mm.
irregular, what their problems are.
Mm.
That is only when you can make a diagnosis and offer appropriate treatments for them.
Okay. So does the person's environment have an impact on the menstrual health entirely?
Environment, well,
Mm.
environments can also play a role, but
Okay.
not necessarily. Well, recently,
Mm.
environmental factors have been implicated in polycystic ovary syndrome,
Mm.
and that might be responsible for
Oh,
irregular. That is those.
cycle.
So that are the environmental things. But again, menstrual issues, even menstrual
Mm.
hygiene is very important, and your
Mm.
environment where you are, the kind of people
Mm.
there, interactions can also play a role, but
Mm.
not really because it has to do with the
The
brain,
brain.
the functioning brain, a
Mm.
receptive ovary and
Mm.
uterus, and a functional outlets for the menstruum to flow.
All right. Thank you very much, Dr. Jane. I
You're
think you're really
welcome.
doing justice to the topic. So, is it possible for a woman? I know this is a question that is biting out on some people. Is it possible for a woman to get pregnant while she's menstruating after she has had unprotected sex during that period? Is it possible?
Well, it's not possible, but for women that have
Hmm.
very short cycles,
Cycles, okay.
and now you're now having a very long period, it means that
Hmm.
um the menstrual phases, the phases of the menstrual cycle,
Hmm.
it's not fixed for everybody.
Hmm.
And what affects the menstrual cycle is the first days. That's what we call
Hmm.
the follicular phase.
Hmm.
Because the luteal phase, the end after ovulation, is fixed. So
Hmm.
once a woman ovulates, she sees her period in 14 days.
Okay.
So now a woman that has a 21-day cycle
Hmm.
and now she's menstruating for 8 days, the tendency is for her, by the time she's ending a period,
She's
she's
starting
likely to
another phase.
ovulate.
Okay.
And at that time, the blood
Hmm.
has ceased. She might
Oh.
now have an unprotected intercourse and get pregnant, and would
Oh.
assume she got pregnant while
Hmm.
menstruating, but that would likely be at the end of
Hmm.
the menstruation.
Hmm.
Yes. So
Okay.
common it might be seen in people with very short periods
Hmm.
and short cycles and long
Hmm.
flow.
Hmm. Wow. I'm getting a lot. So, um, I have this question. Do you think the education about menstrual health, menstrual hygiene should just be related to just girls, the girl child, the woman, or it should be all around?
Well, I think it should be all around.
Okay.
It should be everyone should be responsible for menstrual health
Okay.
and menstrual hygiene
Hmm.
products and all of that,
Hmm.
so that the girl should be able to have access.
Hmm.
It's difficult for a young lady traveling
Hmm.
to say, driver, please, I want to change my sanitary pad.
That's
right?
true. That's very
But you
true.
see, everybody just says, please, we want to pee, we want to use ourselves, please
Mm,
stop the car.
yeah.
I think the environment should be made conducive. And if we educate the men,
Mm,
they might take it easily and understand with the women. And
okay.
women will have access to good toilets where they can change their sanitary
Mm,
pads.
mm,
They can have access to sanitary pads because I could tell you that there are children that don't go to school on their menstrual days because there is no menstrual product to use.
mm,
So this can be made available. And when we have policymakers who can make these things available for girls and
mm,
women, I think it's now all inclusive because the men will be
mm,
part of it,
mm,
also helping them change their sanitary towel,
mm,
giving them the shoulders to lean on
mm,
when they have very bad menstrual pains and all of that. So
mm,
everybody should be aware of the problems of menstruation, how it can affect fertility, and how devastating some of these
mm.
complications can be.
Okay, thank you. So, from what you just explained now, some of these menstrual health products, menstrual care products. So, is there a particular product you would recommend, or everyone we see out there is safe to use?
Well, not to sound as a brand ambassador, but
Yeah.
every sanitary towel is
Mm,
good, right?
mm,
So long as they meet the criteria and they've been certified fit for use
mm,
by the NAFDAC
mm,
NAFDAC, so that's fine. There's also menstrual cup.
yeah.
Well, some persons use tampons.
Mm,
Tampons are, well, the
mm,
thing with that is that if you leave them for too long,
mm.
the blood stays in there. Blood is a very good medium for bacteria
Oh.
to grow,
Mm,
and that would increase their risk for infection.
mm,
So the girls need to know that they need to take it frequently. And
mm,
tampons for the small one just takes about 5 mils of blood.
mm.
The big ones about 10. So it's not
Okay.
something you should leave for long.
Oh, okay. So generally, the product should not be left for long,
Yes,
regardless.
even
Mm,
the sanitary pads and cups. That is why menstrual hygiene too is also taught, and we are talking about making places for changing of sanitary towels available for the girls
okay.
and
Uh,
women.
all right, thank you. So we have a question from a viewer. Thank you very much, Mafeng David, for your question. It says, "Please, can we say periods are irregular when the date change or or the period length or the length of the period?" I think.
Okay, so we cannot irregular periods.
Mm,
uh, it's not irregular per se.
mm,
What is constant about menstruation is the fact that the date will change. Like I
mm,
would like to remind us that in our bodies, it's
mm,
just the hormones that just, okay, I did this, and it doesn't follow a calendar
mm.
per se.
Okay.
So what changes is the date. So
Mm,
long as we have established that a normal menstrual cycle should range between 21 and
mm,
35 days, it means
mm,
once we have period trackers, if it
mm,
falls within this date, it's fine, it's not a problem. If your period is not extending beyond 7 days or
mm,
less than 2 days,
mm.
it's not a problem. Because for some months you might have it heavy and you can
Mm.
have it light. It's still not a problem.
Okay.
Yes.
Are there foods that, I know a lot of people will be curious. Are there foods you could eat during some of this, especially maybe for some people experiencing pain, those with heavy flow? Are there particular foods that could help to
Well,
lighten this, or
no, nothing. Yeah, you
nothing
just
helps?
eat healthy during your
Mm,
periods,
mm,
maintain a healthy lifestyle,
okay.
good diet, balance, and all of that.
So for
There's
a
no
person
particular food.
experiencing heavy, like I'm more concerned about that, somebody who is always having heavy periods, what can we do for such a person?
Well, heavy periods, we
Mm,
have established that there are many causes for that.
mm,
Commonly,
mm,
mentioned fibroids,
mm,
depending on the location. I mentioned fibroids can also cause
mm,
pain.
um,
Then, so it depends. So if you have a woman heavy periods from
mm,
that, there are a lot of things you can do. We have
mm,
drugs, we have hormones, we
mm,
have surgical interventions and
mm,
all for them.
mm,
Then those that have heavy periods from adenomyosis, same thing. For every heavy period, there are things that can be done. There
mm.
is no one heavy period or any cause of heavy period that doesn't have a treatment plan. So
Okay.
it can either be a conservative one or
Mm,
something more aggressive. But for whatever it is, heavy periods can be easily managed any day,
okay.
anytime.
So whatever the symptoms might be, there could be a management
They all
for
have
it.
management, yeah.
So viewers, you heard it from Dr. Jane. There is a management for every of this. And then if you're having questions, you could run to the nearest facility close to you, ask questions, don't just assume. So I have a question here. So what are some of the treatment options readily available at ABS hospitals to aid women who might be having these irregularities and want them to achieve pregnancy?
Well, we have talked about irregular periods and the common causes. So we mentioned fibroid, we talked about treatment options. Commonly, we have also what we call the polycystic ovary syndrome. It's notable. Once you hear a woman talk about irregular period, you might have polycystic ovary syndrome
Okay.
alongside, and there are options. So while we have treatments for them, we have drugs, we have hormones, we have things to help them ovulate and all of that. You have pinhole surgeries where you can puncture holes on their ovaries and help them to ovulate. We also have fertility options where they
Okay.
can have assisted reproductive techniques like IVFs and IUIs, depending on their whole range. So, depending on the cause of your irregular period, there's a treatment plan for those that have scanty period, probably because of um there are scars within the lining of the uterus. We also have options like going into the uterus and taking off those scars and helping the lining of the womb to grow again. That
Okay.
would help them have more
Yeah.
frequent and better flow of their periods. For those that have it based on maybe adenomyosis, that's abnormal tissues in the muscles of the uterus.
Okay.
That's the lining of the womb now in the muscles of the uterus. That can come with significant pain and heavy bleeding.
Yeah.
Yes, there are treatment options, can be drugs, can be surgical intervention
Okay.
for whatever it is. I think for every cause of irregular period, there are a whole range. Then for those that might have difficulties conceiving, like those with endometriosis with significant pain and the whole organs in the pelvis encased by adhesions and all of that, there are also still options for them. We can
Okay.
take out the pain through what we call laparoscopy. Can also offer them some, but for all of them, we also have fertility treatment for every group, for every category, depending on your situation. There's a solution for all.
All right. So, viewers, you heard it from her. It's all available at Alps Hospital. So, all you have to do is to come over at Alps Hospital, ask for Dr. Jane. She'll, she'll be available to answer any question you have and then provide you with every intervention, assist you along everything you would need. I think she'll be here to support you throughout. So I want to say thank you, Dr. Jane. It's been an amazing session with you. I can tell you I learned a lot. I was taking a lot of notes from what you said. And I hope, dear viewers, you did the same. So thank you for sticking around with us to this time. Thank you for liking. Thank you for commenting. And thank you for sharing. We really want to say thank you for always being here with us. So we'll see you again next time. It's a good time. Have a good day.
Bye.
Bye.